But what you saying, Jimmy? Me saying a hot minute, you know. We're going to say that it's been a hot minute for real. You want to know something? My mother told me that I can't come out my house because of COVID-19. I know we ain't safe out here for a little bit, but still I gonna have some fun though. Well, my say can't leave the house unless I'm vaccinated. But you scared of the vaccine? Nah, sis. The vaccine's safe.
VI people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better, not worse.
I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe.
Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated.
I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe.
Brought to you by the Virgin Islands Department of Health MCH program.
Virgin Islands veterans, I'm standing here on Veterans Drive, built in honor of us, Virgin Islands veterans. But we now must do our part to bring more VA medical benefits to our shores. How can we do that, you may ask? Get on www.va.gov and get registered. This is the way that we can do our part. Get registered at www.va.gov. We're counting on you.
The Atlantic hurricane season begins on June 1st and lasts through November 30th. Please take necessary steps to protect you, your family, and the community.
Begin collecting supplies such as bottled waters and non-perishable food, batteries, radios, games for children.
Don't forget about your pets and especially your elderly family. Take time now to trim trees, install or check shutters. Talk to children about hurricanes and allow them to pack their own go bags.
These activities can help reduce anxiety in the event of a storm. We're a small community.
Together we can ensure our islands, homes and families remain prepared for hurricanes.
Register for Alert VI emergency notification by visiting vitima.vi.gov. Make a plan.
Be prepared.
Stay informed.
Good day again. Sorry about that. Welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of September 13th, 2021. For the benefit of the radio listening public, I am Government House Communications Director Richard Mota. For this afternoon's briefing, I am joined by Dr. Esther Ellis, who is here on behalf of Health Commissioner Hussein Kanasion to share the latest COVID-19 data and information on where Virgin Islands residents can get a free COVID-19 test and vaccine this week. Also joining me this afternoon is Ms. Verita Carmichael to announce the winners of this week's Vax to Win lottery on behalf of Director Raymond Williams of the Virgin Islands Lottery Office. But before we go to Dr. Ellis this afternoon, last week, the territory's pre-K through third grade CTEC and modified instruction learners returned to in-person learning. The Brian Roach administration and its Department of Education fully understand the need to have our students back in the classroom setting and have worked with the Department of Health and the CDC to put in place protocols that would help minimize, to the extent possible, the risk of COVID-19 exposure to our students while on campus. Last week, the department took that bold but necessary step forward for our students. But as we know, there is no way to ensure you have zero risk of exposure to COVID-19. And so unfortunately, the Department of Education had to revert to virtual learning per its health and safety protocols at 2 of its 15 centers learning centers currently engaged in in-person learning. Thankfully, those students are returning to in-person learning today. And so I want to take this time to welcome back the students who attend both the Yalamulla Elementary and Pro B Larson K through 8 schools, and ask that we all as a community take the precautions seriously and take the necessary steps, if not for ourselves, for our children and others in our community who are vulnerable. Parents and guardians, please try your best to do the things you know work in limiting exposure. 1, wear your mask when you are out and in the workplace. Ensure your children correctly wear theirs. 2, take serious the guidance to practice social distancing and avoid mass gatherings. And 3, please get the vaccine if you are able and eligible. The only way we can get through this pandemic is by doing so together. Dr. Ellis?
Good afternoon, and thank you, Director Mota. As of September 13th, 2021, a total of 174,045 tests have been conducted in the territory. Of those tests, 6,289 individuals have tested positive, and the 7-day positivity rate is 3.5%. There are currently 229 active cases in the territory, 78 on St. Thomas, 145 on St. Croix, and 6 on St. John. 5,994 cases have recovered, and unfortunately there have been 66 fatalities. I would like to extend condolences on behalf of Commissioner Encarnacion and the Health Department to the family and friends of those we have lost to COVID-19. Last week, we had our first death due to COVID-19 in a fully vaccinated, hospitalized individual. Therefore, 98.5% of our deaths have been among unvaccinated individuals. This is a reminder that the vaccine was developed to lower the risk of transmission and to lower the risk of hospitalization and death, which is what it does. The highest risk of transmission and illness, even if vaccinated, are in those with chronic diseases, most notably obesity, diabetes, hypertension, heart and kidney disease. This is not new knowledge, and a reminder to still take all the precautions we've discussed, even if you are vaccinated. All layers of mitigation, vaccination, masks, social distancing, hand hygiene, environmental cleaning are essential and must work together while we try to achieve community immunity. As of September 7th, 2021, more than 176 million people in the United States have been fully vaccinated against COVID-19. During that same time, 2,675 vaccinated individuals with COVID have died. 87% of those deaths were those over 65, and 27% of those deaths were persons who tested positive for COVID-19 at the time of death, but the death was not COVID-related. Simply stated, if the virus is circulating and there are people who do not have immunity, the virus will continue to infect, spread, and potentially change to stronger variants. The Delta variant is now the predominant strain in the USVI. The majority of the population vaccinated, or at least 70%, is necessary to effectively stop the spread of COVID among each other, ending the likelihood of severe disease and death. Right now, we are at 52.4% of those over 18 years old in our population are fully vaccinated. From our hospital, the Governor Juan F. Louis Hospital and Medical Center reported 1 COVID-19 admission with no patients ventilated, and Schneider Regional Medical Center reports 3 COVID-19 admissions with 1 patient ventilated. Monoclonal antibodies, we continue to offer this treatment to unvaccinated or partially vaccinated COVID-positive patients with mild disease or high-risk exposed asymptomatic individuals. You are encouraged to accept this treatment early when the treatment team contacts you. If you have had COVID-19, there is no need to wait after recovering to get the vaccine. To get vaccinated, please call 340-777-8227 or simply walk into any of our community vaccination centers. You can also schedule an appointment online at covid19usvi.com/vaccines. Families can also call the hotline to schedule an appointment for homebound relatives. Our mobile strike team will come to the home of homebound individuals. If you have only received 1 dose, it is extremely important to get your second dose for Pfizer or Moderna. If you have missed your 3rd or 4-week return appointment, you can still get your second shot at any time. Please make the effort to get your second shot, as you are significantly less protected with a partial vaccine. If you are the parent or guardian of a child aged 12 and up, please make sure to accompany the child to his or her vaccination visit and bring an ID for both the child and you, as well as the child's birth certificate. To schedule an appointment for the COVID-19 test, please call the EPI hotline. The hotline is open 7 days a week from 8 a.m. to 10 p.m. at 340-712-6299 or 340-776-1519. You can also schedule an appointment online at covid19usvi.com/testing. Pop-up testing on St. John is available at the Vipa Gravel Lot on Wednesdays from 1 to 4 p.m. I want to remind you, if you are COVID positive or a close contact, stay home. It is important to decrease the spread, especially to the unsuspected, more vulnerable Virgin Islander who may contract COVID from you, be admitted, and potentially die. Remember, our highest mode of transmission is community spread. In reference to schools being open now, do not send sick children to school. Also, if a household member is positive, that means you cannot send your child to school. We have seen some school closures due to students showing up to school sick and close contacts of positives at school. It's up to us as a community to do the right thing, keep sick kids home, and if someone in their house has COVID, keep them home. Special events. Environmental Health wants to remind you to visit covid19usvi.com, and you can follow the link that says, quote, for event planners, special events form, end quote. By following the special events guidance, the host can prevent the virus from spreading around your party as much as possible. And lastly, a big congratulations to our vaccine lottery winners. Don't forget the Healthcare Heroes special drawing will be held in October. The last day to register is October 1. You can register online at www.vaxtowinusvi.com. And to keep up with the latest information, please visit the U.S. Virgin Islands Department of Health Facebook page or our website, www.covid19usvi.com, And for COVID-19 health information alerts, text COVID-19 USVI to 888-777.
Thank you, Dr. Ellis. And I extend my condolences on behalf of Governor Bryan and Lieutenant Governor Roach to the families and loved ones of those individuals, and pray for a safe and speedy recovery to all those who are currently hospitalized. I also want to take this time to wish well our Education Commissioner, Ms. Raquel Berry Benjamin, as she recovers from COVID-19. In some better news this afternoon, Virgin Islanders or Virgin Islands families who qualify for the child tax credit have begun receiving those payments this past week, thanks to the hard work of the Virgin Islands Bureau of Internal Revenue and Department of Finance. This has been a tremendous undertaking, as it is the first time that the child tax credit is being issued in advance payments to Virgin Islanders who qualify, as opposed to it reflecting on their income tax return. We have received several inquiries regarding how to distinguish between the child tax credit and the income tax refund checks. The child tax credits from the Virgin Islands Bureau of Internal Revenue are coded. So on the check, you will see a code that says 2019-1 ADV CTC 2021. This is how you can tell the difference between an income tax refund payment and a child tax credit payment. Qualified families can expect to receive 5 monthly payments of $300, and this is based on your income. So the qualification to receive this child tax credit is income-based per the guidelines of the federal government. The 2021 income taxes, your monthly payment, so you will receive 5 monthly payments of $300, and those payments will be issued from the Bureau of Internal Revenue and the Department of Finance this week. For some families, these checks represent a critical economic support, and the Brian Roach administration is pleased to champion this initiative on behalf of children in the territory. In more good news, the Virgin Islands Housing Finance Authority has begun issuing benefit payments to the 517 families and individuals eligible to receive benefits under the Emergency Rental Assistance Program. Governor Bryan is encouraging eligible Virgin Islanders to take advantage of this program while there is still time. It can be used for not only rent, but for utility bills as well. For more information on the Virgin Islands Emergency Rental Assistance Program, or to see if you qualify and to get an application, visit erap.vihfa.gov or contact the Virgin Islands Housing Finance Authority at 340-777-4655. As I mentioned at the top, here to announce this week's winners of the Vax to Win lottery is Ms. Farida Carmichael on behalf of Raymond Williams, who is the Executive Director of the Virgin Islands Lottery Office. Ms. Carmichael.
Good afternoon. Thank you, Director Mota. On behalf of the Executive Director, Raymond J. Williams from the Virgin Islands Lottery, I'm pleased to announce this week's Vax to Win winners. Ms. Ingrid Iwak from the St. Thomas St. John District, and Ms. Tashanda Benjamin from the St. Croix District. Again, Ms. Ingrid Iwak from the St. Thomas St. John District, and Ms. Tanisha Benjamin from the St. Croix District. Thank you. Congratulations.
Thank you, Ms. Carmichael. Congratulations again, Ms. Iwak and Ms. Benjamin. Thank you for taking your best shot and for doing your part to help our community. Don't forget that there is a special drawing just for healthcare workers and allied healthcare workers. This includes nurses, physicians, paramedics, and the like. If you want to register for this drawing, you can do so online at Vax to Win USVI or by calling the Vitima hotline at 340-777-8227 or in person at any of the Department of Health's community vaccination centers or the St. John Administrator's Office. The deadline to register for our Healthcare Heroes special drawing is October 1st. The first prize is $25,000, second prize is $10,000, and third prize is $5,000. 3 winners will be chosen from the St. Croix district and 3 winners from the St. Thomas St. John district. Also, there is I will be remiss if I did not mention that the Department of Labor has done some vaccine drives in their outreach, and they have also registered more than a dozen individuals or have signed up more than a dozen individuals for vaccines in both the St. Thomas and the St. Croix districts. So congratulations to them and for those individuals who are going out there and doing what they need to do to protect themselves and our community. In closing, we are saddened by the loss of 2 Virgin Islanders who were true pillars in our Virgin Islands community. Former St. Croix Senator and longtime talk radio host Holland Redfield, and former Virgin Islands Solicitor General and community advocate Elliot Mac Davis. Unfortunately, both men passed away this weekend. On behalf of Governor Bryan and Lieutenant Governor Roach, our condolences go out to their families and all in the community who today are mourning their loss. Their respective contributions to our Virgin Islands community are immeasurable, and they will both be sorely missed. Like many, I had a close working relationship with Holland. Not only was he a critical voice during the storms, helping out and getting critical information to inspire calm during the hurricanes of years past, but he was also a key conduit for the dissemination of information regarding COVID-19. And so we are truly saddened by his passing. As a reminder, before we leave this afternoon, Governor Bryan, Lieutenant Governor Roach, alongside members of the Governor's Cabinet, are hosting a virtual town hall meeting this Wednesday, September 15th, from 5:30 to 7 p.m. via Zoom link. Officials from DPNR, DLCA, the Department of Tourism, Public Works, VIPD, and the Virgin Islands Waste Management Authority will all be on hand during this Wednesday's town hall to answer any questions that residents may have. More information, including the link, will be available after this afternoon's press briefing on Government House's Facebook page. That concludes our briefing this afternoon. I will take any questions from the media if there are any. And we have with us this afternoon Ms. Suzanne Ellis from the Virgin Islands Source. Thank you for joining us, Suzanne.
Thank you, and good afternoon. As you know, the President last week implored governors to enforce mandates to require vaccinations in federal employees and schools, et cetera. Has Governor Bryan instituted anything like that yet? And if so, when?
The governor has not. We know, of course, that the vaccines, even when someone is fully vaccinated, that there is still a possibility of transmitting the virus, albeit the vaccines offer a lot more protection than if you were not to be vaccinated. But currently, we are encouraging all Virgin Islanders to go out and get the vaccine, hence all of the different incentive programs that are out there right now. And so that is the governor's stance as of this moment, is to continue encouraging all Virgin Islanders to get vaccinated. And until we have exhausted all of the possibilities that we have and all of the tools and incentives that we have at our behest, there is no plans for a vaccine mandate.
And so does that mean that there's no longer a mandate or strong encouragement for government employees?
Well, of course, we strongly encourage government employees, especially frontline employees, our law enforcement personnel, our first responders, but there is no mandate from the government for government employees at this current juncture.
And one last question. Do you have any idea, Dr. Ellis, probably you would know this, how many, maybe a percentage of hospital workers and other healthcare workers and educators are vaccinated?
So each of those categories are a little different.
Right.
I can get you those numbers for sure, but I don't have them right in front of me.
That'd be great. Okay. Thank you.
Thank you, Suzanne. We have Lasiba Knight joining us virtually from the St. Croix Avis. Lasiba, go ahead with your question.
Hello, good afternoon. Hi, Lasiba from the St. Croix Avis. My first question is for Dr. Ellis. Dr. Ellis, last week we heard from Commissioner Hussein Encarnacion, and she informed the public that the territory had perhaps the lowest vaccination rate in the country, as well as per capita one of the highest infection rates. And when you look, our vaccination rates actually seem week on week to be growing really rapidly. September 7th, we had about 43,000 people fully vaccinated, which is about 43%, and now we're over about 52. And so I'm wondering if we can contextualize and see what that means. Are our vaccination rates really that low, or?
Yeah, I mean, that's a good question, and over time that changes, the answer to that changes. So we have had a significant uptick in individuals getting vaccinated as a result of many things. As a result, I think, of our community seeing a lot of deaths within our community. So that's an unfortunate motivator. And also there are a lot of incentive programs out there right now. And so we have seen a significant uptick in people getting vaccinated, which is great. I just pulled up the data while you were asking that question, and the lowest state as far as fully vaccinated right now is Alabama, and that's 35%, followed by Arkansas, Arizona, and then the U.S. Virgin Islands is right around. So we're in the bottom 10. We're not the lowest anymore, which is great. But we are still very low compared to other states. One of the highest is Maine, and they have over 70% of their population is fully vaccinated.
Awesome. And then, Rich, I have a bit of a policy question for you.
Sure.
It touches on school buses on St. Croix. We were supposed to see school bus service reinstated, I believe today. And now I'm wondering, why are the school buses on St. Croix suspended indefinitely? Are negotiations with the vendor still ongoing, or?
The Department of Education will have to answer any questions relative to negotiations for the operation of their school buses. I could tell you that as of today, I know that, even though we have in-person learning for some of our pre-K through third grade students, that we still do have some significant COVID protocols in place, and so perhaps they're, busing and how we go about doing that safely is probably one of those considerations that is maybe preventing school buses from being in operation today, Monday, September 13th. If I may, Lasiba, I'd also like to thank you for asking that first question, because it really does provide a little bit of context to the earlier question by Suzanne from the VI source. We have seen some promising upticks in the vaccination numbers as a result of what we think is a result of the different incentive programs that are out there. And unfortunately, we're not. It's not lost on us that perhaps the most recent deaths in the community may be, like Dr. Ellis said, an unfortunate motivator. So those are all things that go into the larger context of not having a mandate in place, is that we are seeing the numbers grow where, they're going positive, they're going up as opposed to plateauing or going down. So we just want to continue with those vaccinations or with those incentive programs to encourage people to get vaccinated. Thank you. You had another question, Lasiba?
No, that's it for me. Thank you.
All right. We have the Virgin Islands Consortium on the line. Go ahead with your question.
Hey, good afternoon. I'm Kyle Murphy with the VI Consortium. First question. The Department of Education has refrained from speaking out about the developing child molestation matter at THAS, instead providing a statement condemning the alleged crimes and stating that an investigation is ongoing. We haven't heard from the governor on this matter. Is there a statement from Government House?
Well, the Department of Education did put out a statement, and right now I could tell you that the department is aware of the allegation and is cooperating fully with the federal authorities in the ongoing investigation. That is the statement from the Department of Education, and we support that statement from Government House.
Okay, and then about the breakthrough case where a person vaccinated against COVID-19 died of COVID-19, what details can be provided to the public? Like, for example, what island did it take place on, and was there severe underlying conditions, for example?
Thank you for that question. Due to HIPAA and privacy protection, I can provide no details about that specific case.
Okay, thank you.
Do you have any further questions?
No, I do not.
All right, thank you for that. Do we have any other questions? Suzanne, do you have any other?
Thank you. It made me think of one more question I had. Not following the president's guidance regarding mandates, is it possible that that could impact any of our federal funding?
So President Biden's mandate was specifically for federal employees and contractors, and so it wasn't directed to local government workers.
Okay, but wasn't it for schools as well?
Sorry?
Educators? Doesn't his mandate extend to educators and healthcare workers?
Not that I follow, and I don't know that there have been any stipulations put on any stipulations to prevent federal funding on those who are not in compliance with those mandates.
Thank you.
Thank you, Suzanne. Just a quick reminder that the Water Island Town Hall is for Water Island residents only, so the governor has been, and the lieutenant governor and members of the governor's cabinet have all been doing town hall meetings territory-wide. Most notably, there was the first on St. John last month. This one is going to be on Water Island, so respectfully we ask that we give Water Island residents an opportunity to have their concerns and their questions addressed. So this is for Water Island residents only. There will be forthcoming town hall meetings for St. Thomas residents and St. Croix residents as well. I think that is all of the questions that we have this afternoon. Thank you for your questions. That concludes our briefing. Remember, please wear your mask, continue to practice social distancing, and get the vaccine now that it is available. Thanks. Have a good afternoon.